So much for joining us.
And I'm Tyler Mathison. Thanks from me as well. Have a great evening, everybody. We'll see you back here tomorrow night.
Nightly Business Report has been brought to you in part by
TheStreet.com. Up-to-the-minute stock market news and in-depth analysis. Our quant rating service provides objective, independent ratings daily on over 4,300 stocks. Learn more at TheStreet.com/NBR.
Programs on MPT are made possible by our members and the following.
Hi, I'm David Scheffnacher. For over 10 years, my company has supported Maryland Public Television. But now, more than ever, Maryland companies need to step up and help MPT. Your contributions can make great programs happen. Thank you.
Tonight on Direct Connection, the founder of a new Maryland health insurance company joins us to answer your questions on the Affordable Care Act. That's tonight, live at 7:30 on MPT.
Public Square on MPT. It's TV worth watching.
The Beatles, Cassius Clay. This was the toppling of the order.
It was the year we stood up.
We want freedom by any means necessary.
And split apart.
Extremism in the defense of liberty is no vice.
It was a door to our future. Once we went through it, there was no going back.
1964 on American Experience.
Tuesday night at 8 on MPT.
My parents met because they both worked on the railroad. There was actually no question I was going to go to work on the railroad. I knew that from the very beginning when I was a little kid. My dad taught me to be kind and think about other people. And that is what I'm trying to instill in my family. My granddaughter is named June Elizabeth, but I call her Junebug. My hope is to teach her about kindness and about the love of animals and nature. I want Junebug to have the same opportunities I had by watching PBS. It has helped me understand so many things in our world. My husband and I feel so strongly about our PBS station that we've included them in our estate plan. PBS is part of our values, things that we cherish, and we want to pass it on to the next generation.
On Nova, a weapon of mass destruction deployed in the First World War. Colossal German airships delivering death from the sky.
Huge burning fires in the streets. Total war had been born.
What made this weapon so lethal?
The war is carried into the heart of the enemy territory. A big bag full of hydrogen. Why couldn't we shoot them down?
The explosive tale of the Zeppelin terror attack.
Wednesday night at 9 on MPT.
See the legends of 70 Soul live in concert on Saturday, June 14th at the Modell Performing Arts Center at the Lyric. Don't miss performances by Russell Tompkins' New Stylistics, The Shy Lights, Harold Melvin's Blue Notes, and Cuba Gooding Sr. For tickets and more information, please call 1-800-222-1292 or visit mpt.org/events.
Direct Connection is made by MPT to serve all of our diverse communities and is made possible by the generous support of our members. Thank you. Live from Maryland Public Television, this is Direct Connection with Jeff Salkin.
Hi, everybody. Thanks for tuning in for Direct Connection. Later in the program tonight, the high cost of auto insurance. We'll find out what one group wants to do to make it more affordable. That is ahead. First tonight, new developments in the fast-changing world of health coverage. Joining us is Dr. Peter Bielenson, the founder and CEO of the Evergreen Health Co-op. Doctor, thanks for stopping by.
Thanks for having me.
Appreciate the house call.
You're welcome.
For people who aren't familiar, your new co-op is a combination insurance company and provider.
That's exactly right. It's enabled by the Affordable Care Act, aka Obamacare. And so we're competing against the big guys, Care First, Kaiser, United, et cetera. And we think we actually have a much better product, which is why we're on the marketplace.
Yours is a little bit like Kaiser Permanente?
We like to say we're Kaiser done right.
I'm sure they appreciate that.
I'm sure they do.
Okay, so the big focus is what's happening with the exchanges. The governor was on CNN over the weekend. There's new data coming out today about how the federal signups are going. The state has signed up about 20,000 people for the private health plans, including yours. What are you seeing? Is the thing working at this point?
It's modestly functional. It's certainly not as functional as it should be. The goal is 150,000 into the private sector and on the Maryland exchange. And basically what we found and what we're recommending for people is that to go on the exchange by yourself is very hard to get all the way through. So the best way to do it is to go to a navigator who's sort of an unbiased observer who are based in each of the several regions of the state through health departments predominantly, who will help you get through. Or if you know what company you want to join, you can call them directly, and their brokers are then allowed, as what are so-called captive producers, to sign you up. And both the navigators and the brokers know sort of the workarounds to kind of force people through. So ours, for example, get people through 30 to 70% of the time. But if you go on by yourself, you're probably 5 or 10%
pull
lucky.
Your hair out and need some sort of blood pressure medication. So what's wrong with that? I mean, it's a website. Where does it bog down?
I've been on 257 times. No kidding.
That explains
257
yes.
times, yes, although I've been like this since I was 20. And I've gotten stuck everywhere from signing up to putting in a password, to having your account frozen, to going to shop, to getting all the way to picking which one you want, all the way to enroll, click the enroll button, and it crashes. So it's anywhere in between. To be fair to the state, it's modestly better than it was a few weeks ago, but it's still not functional.
What are the odds that it's going to be functional by the open enrollment deadline is actually the end of March?
Correct. By March 31st, you have to enroll in a plan, or else you are exposed to federal tax penalties. In other words, the individual mandate. And it's probably not going to be expanded past March 31st. So there's going to be a crush of people applying in March. And I would bet that the exchange will be modestly better still. It will kind of limp along until March 31st, and then a decision will have to be made in the time between the March 31st enrollment period ending and November 15th enrollment period, the beginning of that next enrollment period, that the state will have to decide to take down the exchange and make a real strong decision about whether it's really fixable or not. And if it's not fixable, then they probably will switch to the federal exchange, but not before the March 31st deadline.
So I hadn't thought about that. As of April 1st, there's no reason for the thing to be online anymore.
Correct. Because the only reason you would go on the exchange is if you're eligible for the subsidies under the Affordable Care Act, and that since the open enrollment doesn't go past March 31st, there's no point in no one can enroll and get a subsidy during the interim.
Open enrollment periods normally end in the fall or December maybe. Is this a one-off thing?
This was a one-off to start because a lot of the Affordable Care Act's portions of the Affordable Care Act began January 1st, and so they wanted people to be eligible for January 1st, and that's why the next open enrollment period is much shorter. It's November 15th to December 31st next year, at the end of this year.
Let me remind our viewers, if you have a question about health insurance and the websites and how to sign up, you can give us a call. We'll have the number on the screen. You can also tweet a question to @MPT News. That's our Twitter address, @MPT News. So that's the thing I most wanted to focus on. There are probably people out there who need to sign up. And what you're saying is you're going to need help getting through this website, but help is out there.
It is, and that you can obviously go to our website, evergreenmd.org. If you want to join Evergreen, you can go to Kaiser, United, Care First. They all are available. The basic point to make is that it's very hard to get through on your own.
And we know they have a telephone hotline. Does that help?
Telephone hotline, as you and I were trying it just a few minutes ago, I've called 60 times, and unfortunately, even though they're increasing the number of people that are sitting through the call center, in general, they're between 30 and 50 callers ahead of you with a 50 to 75-minute wait period. So it's even hard to get into the call center to get help.
Right. I don't want to focus too much on the political blame placing angle here, but focusing on how people can make the thing work best. If you need the subsidy, if you think you might qualify for a subsidy, you can't just go to the Aetna website.
Absolutely not. You have to go through the exchange. That's sort of the human aspect of this, which gets lost in the politics. I mean, I'm kind of fed up with the politics of it, both on the left and the right, both at the national level and here in Maryland. The bottom line is there are 750,000 to 800,000 Marylanders who are uninsured, the vast majority of whom are working class or middle class people. This was set up. Obamacare is a great thing, and it was set up to get people coverage that they had not been able to get before. And because of the squibbed openings of the state and federal exchanges, unfortunately, those people have not been able to sign up. Let me give you one quick example of such a person that was finally able to sign up with us after trying and trying and trying for months. 39-year-old gentleman, kind of a young invincible, which is what you want to get in, hadn't had insurance for 13 years, came into one of our lovely centers at the Rotunda, was so struck by the nice surroundings that were available to him instead of a clinic where there are massive numbers of people that he started crying and was so appreciative of the support that he got, he actually wanted to come back 2 weeks later to have health coaching. So those are the kind of people that we want to be serving, and that's what's getting lost in this political firestorm.
Let's take a phone call. Queen Anne's County, this is Valerie. Valerie, thanks for the call. Go ahead.
Hi. I wanted to ask, if you're aware of how many people might be confused about how exactly you enter your income when you're on the site. I know that I went on and, put in the gross wages, but I had problems with the site, so I called a navigator, and she told me that, it was just your gross wages that you entered in, but as I understand it, you actually are supposed to enter your adjusted gross income. And I'm wondering how many people might be confused.
Valerie, did you succeed in the end?
No, I didn't. No.
Okay, thank you very much.
Yeah, okay. I mean, one of the issues that, I can't remember when we were talking about this, either before the show started or at the beginning of the show, that isn't this just a website? I mean, shouldn't it be able to be like Travelocity? Well, in all fairness, it's more difficult than Travelocity, but it could be much simpler. And to Valerie's point, there are different things, different aspects like alimony and things like that can be put in as sort of deductions and adjustments. And then you're supposed to provide supporting evidence afterwards, after you've applied, but I've not run into anybody who's been actually asked for that supporting evidence. So, in all honesty, I actually don't know well enough the answer to your question, and it's because this is really made more complex than it needs to be.
But you can't fudge it. You can't say my income is this small number. If it turns out to be untrue, you'll hear from the IRS
correct.
Probably a year from now.
If there's enforcement, but correct.
Right. Anne Arundel County, this is George. George, thanks for calling. Go ahead.
Thank you. Say, I wonder, since your guest had a startup business here, sort of what the communication has been between him and the state, and him, the state being receptive to his ideas on the problems they're having, as well as vice versa. So just a communication issue of the state recognizing that there's such a serious problem that they need some feedback as well as some fix-its.
George, thank you.
Well, I have an unusual situation. I was the health commissioner in Baltimore, and my successor, after 13 years, is the current health secretary of the state of Maryland, who's running the exchange, basically.
He takes your phone calls?
I talked to him. I just talked to him at the gym 2 hours ago. I was at the gym. He wasn't. So we do have, in their defense, they have been quite open to hear all of the problems that are going on, and we lay them out, and that doesn't mean they necessarily get fixed, but they have been open to hearing them.
All of these problems have sort of obscured the question that people face about picking a plan, not only a provider, what the company is, but the bronze, gold, titanium, whatever it was. And there's some serious pros and cons because the lower end plans I've read have these big deductibles.
Well, the biggest problem the single biggest problem with this shopping experience is that there's no out-of-pocket calculator. All there is the sticker price, the premium. And so a insurance company with a certain color has picked the top 7 or 8 programs that you can pick, policies you can pick, that are listed in order of how much they cost, are all very low premiums with $6,000, $5,000 deductibles, maybe $12,000 for a couple. There's a reason the premiums are so low, but because the exchange's shopping site does not show out-of-pocket calculation, like how much it would really cost a human being after a year's worth of care, you know, going to the doctor a couple times, getting a couple of prescriptions, maybe 1 ER visit for your kid, we come out at just as good and just as economical as the other company, but because the out-of-pocket calculator does not work and is not showing up on there, all people see is the premium. Well, if you don't know much about insurance, which the average American doesn't, you're going to pick a $150 plan, not realizing that it's $150 times 12 months of premiums plus $6,000 of expenses before you get any insurance coverage at all. Yeah. So if there's any advice to make, it's don't just look at the sticker price. You've got to delve deeper.
The point of the whole thing was to get people access to health care, and you could have people who wind up with health insurance who still don't really have good access to health care if you don't have the deductible money sitting around.
That's absolutely correct.
Yeah. Kathleen in Frederick County. Kathleen, thank you for calling. Go ahead.
Yeah, the question is, everyone gets all of this insurance, but I noticed that a lot of doctors are dropping insurances. They don't want to have to deal with it. And the only ones that will be dealing with it is the hospital. Also, a lot of these insurances, they do not cover the overhead for the hospitals and their employees, and not even the doctors. That's one of the reasons why the doctors are dropping the insurances, because the insurances don't cover their overhead.
Kathleen, did that happen to you with a doctor's office?
Yes.
Okay, well, what part of the state was it? Frederick County. Okay, thank you very much for the phone call. I don't know if that's the concierge practices that are not dealing with the health insurance world at all and charging people an upfront fee to be part of the practice. I don't know how big an issue that is, but let me tie one other thing into it, which is the large number of people. We're way below estimates for people signing up for private health care, but people signing up for Medicaid is off the charts. So you can have a surge of people who qualify for that, and not everybody takes it.
Very true. Very true. That's an issue of access to care and accessibility of primary care, particularly. Your point is well taken about the so-called concierge or boutique medicine, much more common in more affluent counties, much less common in Baltimore City, where I'm from, because the income of folks that are there, and that does a sort of a double disservice. By paying for primary care, you also have to pay other insurance, and it takes primary care docs out of the general population, if you will, to serve folks. So there are fewer primary care folks than there would otherwise be, and we already have a dearth of primary care.
Right, and many of those
worse.
providers are doing it because they can streamline their practice, they can spend more time with the patients, They can make more money, and so forth. Now, on the Medicaid front, does Evergreen accept it?
We actually have a contract with a Medicaid managed care organization, and are probably going to join with another one. And it actually deals with the churn issue, which if I can just have 10 seconds to explain. So currently, so at our health centers, let's say Peter is a working class fellow, is a construction worker. I make enough money to be on the exchange and get a subsidy. I get cut back a few hours in my work day, and I'm now eligible for Medicaid. Normally, I would have to leave my primary care doc because that person wouldn't take Medicaid oftentimes, and you'd have a disconnect between the time of coverage and between getting health care, or you may even fall out of health care altogether. But because of our deal with the Medicaid MCO, the managed care organization, the payer changes, but the patient keeps continuity of care, and it's seamless. So there's not the churn of people moving to and fro. And according to the Health and Human Services Department and the federal government, we're not only the only group doing that in Maryland, but maybe the only co-op in the country doing it.
Very good. Peter Bielenson, founder, CEO of Evergreen Health Co-op. Doctor, thanks very much. Good luck with everything.
Thanks for having me.
Appreciate the time. Just ahead tonight, the high cost of car insurance. What can be done about that? With more of your calls, we'll be right back.
I don't like the idea that the government can snoop on what I'm doing with my phone.
Really? What government secrets are you trying to hide?
Nothing. It's just that all these stories about NSA surveillance have me thinking.
Well, you sound like a good candidate for the Onion browser.
It lets you use your iPhone or your iPad to browse the internet anonymously by routing you through a series of encrypted connections.
The app costs 99 cents and protects your privacy, which is important if you're engaged in sensitive reporting or are in a foreign hotspot.
Now, there are disadvantages. All that rerouting slows down your web browsing.
And the Onion browser is not exactly packed with special features. You can't bookmark your favorite sites, for instance.
And it's harder to play certain kinds of video.
But I'm still wondering about you. TechCrunch does call this a, quote, mobile browser for the truly paranoid, end quote.
Maybe, but you can't be too careful in the digital age. And that's your daily download.
Antiques Roadshow has good news for some lucky folks in Boise.
You look for certain whistles and bells in objects like this. Well, this one has the whole orchestra.
Wow, goosebumps today.
Is my mom gonna see this? Because I'm not giving it back.
You won't want to miss these discoveries next time on Antiques Roadshow.
Tonight at 8 on MPT.
On Masterpiece Mystery.
What we got?
Bit of a puzzle. This gentleman's already been put through the hands of an undertaker.
Why would anyone steal a body?
I don't know anything.
He threatened to feed me to the wolves.
News to me.
Think of the baby.
These things must be linked.
Careful, Robbie!
I'm getting very tired of secrets.
This has nothing to do with me. Told you a dozen times.
Yeah, well, tell me again.
Inspector Lewis on Masterpiece Mystery.
Tonight at 10 on MPT.
Joining us now to talk about the high cost of auto insurance, Diane Bell McCoy, President and CEO of the Associated Black Charities, and Marceline White of the Maryland Consumer Rights Coalition. Good to see both of you.
Thank you.
Thanks for being with us. You have a forum tomorrow at the Annie E. Casey Foundation. What's the focus of it?
The focus of it is how to make automobile insurance affordable for Marylanders. What we're finding is that in the past 25 years, automobile insurance has gone up 47% in Maryland. And it's too much, for working families to afford, and we want to look at ways and explore ways we can make automobile insurance more affordable for low-income and working families.
Everybody's ears perked up when you said, let's make it more affordable. How do we do that? Where do you want to start?
Well, I think it's also important to talk about why that's so critical. It's not just making automobile insurance more affordable. It's really about economic development. And I don't think people make that connection. Why we're very interested in the conversation and the study they've done is because we're clear that what that does to Baltimore and to many counties in the state of Maryland, it depresses for a number of working poor in terms of the ability to get to employment. That we know that we've got employers that care about this very issue because they can't get the employees they need because we're disconnected by the transportation system, the public transportation system, and the average commute time for anyone is about 30 minutes in terms of any of the counties. Understanding that where the jobs are located, and understanding where in fact there may be workers needing those jobs, employers needing, then you really have an economic development problem, not just an insurance problem.
Well, I mean, we have decent mass transit, not perfect by any means. You're saying that's not the answer.
It is ultimately the long-term answer, and I think the state is continuing to move in that direction, but we're a ways off from that. And there are going to be some places where you really are going to need a vehicle, and there are many jobs where you're going to need that. So having affordable auto insurance is critical for economic development.
Well, so low-income residents are hit doubly, really. I mean, if you, first off, you don't have necessarily the money lying around to pay a big premium. Second, your rates may be higher depending where you live. Is that the case?
Well, what we've found with our research is pretty telling. If you live in Baltimore City and you have a good driving record, on average, you'll pay at least $500 more than someone living in Baltimore County. So you cross the line and you're saving $500, and that seems wrong. Same driving record. We also looked at other scenarios. So people with a high school degree on average pay about $300 more than someone with a college degree, and someone who rents pays $185 more on average than someone who owns a house. So again, it's really the rate factors that they're using end up penalizing people who are low income or who haven't had access to a college education in a way that has nothing to do with their driving record.
What can auto insurance companies in Maryland legally look at to rate a policy? I know there's a dispute in some places about whether a credit score is a legitimate factor.
They can't look at a credit score to determine your rate, but they can, when they're giving you new rates or they're changing your rate, if your credit score goes down, they can use that. And in fact, that happened to a friend of mine who went back to school, had a successful career, went back to school to look at grad school to look at alternative health, and his credit score worsened. He was also going through a family situation, and all of a sudden, his auto insurance rate skyrocketed. And his driving record hadn't changed. He had no accidents. There was nothing different in his situation except that he'd fallen into some hard times.
I think I would add, though, I think the point that Marcella may want to make is also not just about the education as well as working in terms of type of job. Yep. Is that same information the study revealed, the fact that you could have a great driving record and just those variables be there. And so in many cases, the current health insurance, the rates, what they use to determine those rates, keep people poor in terms of that sense and keep them not being able to move up despite having a great driving record.
Absolutely.
What solution do you propose?
Well, one of the things we're really interested in having Maryland explore is something like a California plan. And it's the 25th anniversary of the proposition, I think it was 103, that created the plan. What they've done is a couple things. They have a low-cost insurance plan. It's limited liability, so you don't get as much coverage, but it's $350 on average. You have to meet income limits. You have to have a good driving record. Overall, it's provided insurance for 40,000 people, and we think we'd rather have 40,000 more people insured at a rate they can afford than not.
Let's take a phone call. This is Tom in Charles County. Tom, thanks for the call. Go ahead.
Yes, half the problem this lady's saying about this auto insurance is everybody gets in an accident. I lived in this county since 1976 in the state of Maryland. Every year my insurance goes up, and 90% of the problem is everybody keeps suing people for millions of dollars. The state needs to put a cap on this insurance, and the people in this state needs to turn around and take a look at themselves and say, hey, do I need to sue or do I just need my car fixed?
Tom, thanks for the phone call. You frequently hear the tort reform brought up in any sort of insurance situation. Is that on your radar with this?
I mean, I certainly think it's one of the things that people will look at, and it's one of the things people have to explore all kinds of ways. But I think the core issue is that if more people were insured, you could actually bring the pool down. And what they found in California is that they've been able to expand insurance, keep the rates down, and the insurance companies have still been able to adequately cover people.
Are these people, though, effectively uninsured? I mean, if I get hit by somebody who has the minimum coverage now, I mean, it's really not necessarily enough to cover much in the way of medical bills or replacement of a car. If we reduce those limits, you magnify the situation.
Well, I think the issue is not reducing the limits. I think it's expanding the pool. And I think you can reduce, it's better to have more people covered even if it's a lower liability than right now. They say nationally 1 in 7 people are uninsured. So, you know, we have a problem right now about getting the insurance, and a lot of people, what we find is they buy auto insurance, something happens in their lives, and they end up dropping it because they can't afford it. So we'd rather be able to have people maintain their insurance.
Yeah, and I would also say that is true. I think the study revealed that there was a significant percentage of people who were driving who were uninsured. But I also know that last year, the state insurance pool, in terms of actually changed their policy,
that's right,
it was moving it towards actually having people be able to pay monthly for the premiums. That was not the case up until last year when that legislation changed. They had to pay it all at once. And that meant that you were poor, you were working poor, you had to come up with all those dollars. Similarly, the same challenge in terms of the health care exchange.
And in just a couple of seconds, where do you want to see this go? It's a little late to get this legislature started on it.
I was part of an insurance task force last session, and one of the things they've recommended is creating a new study group to look at this issue. And I think we want to look at all possible options, including the California plan, including auto insurance co-ops, and really be creative about ways to bring the cost down.
Marceline White and Diane Bell McCoy, thanks to both of you. Good to see you. Thank you for joining us for Direct Connection, and have a good night.
This program was made by MPT to serve all of our diverse communities.
Tonight on MPT.
Antiques Roadshow has good news for some lucky folks in Boise.
You look for certain whistles and bells and objects like this.